I'm going to talk to you about how girls and boys with autism are different, and unfortunately, the clarity thing that I'm supposed to address, I have to say, I think it depends, and it depends on a lot of factors that I'll take you through. So this is not a new question, how do girls and boys with autism differ? And in the very first descriptions of ASD as a disorder, Lee O'Connor told us that about 8 boys with autism and 3 girls with autism. And that's the first place where we see this discrepant sex ratio appearing. And that's come up again and again in research, that there are more boys diagnosed with autism than girls. Early on, some of the clinical descriptions comparing girls and boys with autism showed that girls generally had lower intellectual abilities, lower cognitive abilities, lower language abilities, and more severe autism symptoms than boys. But what we know is that because our measures, autism symptom measures, are really affected by IQ and language, we may be seeing here more severe autism symptoms because they occur in the context of more severe intellectual disabilities, at least for some girls with autism. But this pattern has continued even in very large prevalence studies, where we see a disproportionate number of females with intellectual disability as compared to males. Recently, however, the last 10 years or so, there's been an explosion in this idea that we may be missing females at the higher end of the cognitive ability spectrum. And so if in fact these girls are not represented in our studies of autism, then that could be a big reason for the mean IQ of women and girls with autism being lower than that of males. And I think that it's been picked up by the popular media, and the idea that girls with autism are different and that we're missing them. It's also been fueled by observations of clinicians, expert clinicians, saying, I think there's something different about these girls with autism that I'm seeing. However, even if we look at expert clinicians, the data are all over the place in terms of where differences actually lie. And so these are graphs that are a bit hard to see, but you can see that there's a lot of variability. The left-hand side shows the percentage of clinicians who responded that they think that girls show more severe impairments in social communication and repetitive behaviors, whereas on the right-hand side are clinicians saying that they see less severe behaviors in these areas. So even among the expert communities, there is disagreement about whether girls are generally showing less or more severe impairments. So a question then is, how can females with ASD be more severe and less severe than males with ASD? And thank you, John, for introducing this idea that we are not talking about one thing, that in fact it depends on the girls with autism who we're seeing or the boys with autism who we're seeing, and the context in which they are compared. So I just want to give you an example here. Again, the rare genetic events that John just talked to you about. We know that certain rare genetic events are more common in females with autism. And so if we're looking for, if we're looking among individuals with autism with severe to profound intellectual disability, where females are overrepresented compared to in the general population of people with autism, we are indeed going to see lower cognitive abilities and more severe impairments related to that. But if we look, for example, in the Baby Siblings Consortium, which Allison mentioned, about where the vast majority of children have average to above average intellectual abilities, we see that girls tend to show less severe impairments in autism-related domains, but that those are simply mirrored from what girls typically developing girls show in comparison to boys. So don't worry, boys do catch up eventually. But from an early age, there is a female advantage in the manifestation of certain early language skills and social communication skills and play skills. And we see that advantage holds for the girls with autism as well as the girls who go on to not develop autism. So here we have different groups of girls. And here is a list of a bunch of different studies looking at what you would think is a relatively simple question of what is the ratio, the sex ratio of girls versus boys. And on the top, the studies that used so-called active ascertainment methods. So this would be like the Baby Siblings Consortium, where we're actively monitoring kids and trying to figure out who goes on to have autism and who doesn't, versus passive ascertainment methods, where you're taking whoever comes into the clinic. And you see that the sex ratios, although they're all over the place across the board, generally we see a smaller ratio in these active ascertainment methods. So if we're looking for girls and boys with ASD, we find that the ratio is closer together. But if you're waiting to see who comes into your clinic, so in passive ascertainment, you see that the ratio is larger. And this also is similar to what we see in psychiatry in general, where in young ages, boys are referred more than girls for a variety of problems. And so this is one example of that as well. So I think that lumping by sex alone is problematic. Lumping, period, is problematic. And like John said, we have a real lumping problem in this field. But sex is not the only relevant variable. It is a relevant variable, but if we put all the girls together and compare them to all the boys, we're going to get a really confusing story depending on which boys and girls we happen to be analyzing. So a big goal for us has been to try to figure out how we can get larger groups of children with ASD, and this, I think, represents one of the largest groups that we've had so far. These are brand new data, but these are clinical referrals, so all those ascertainment issues apply. But what you can see is that if we look at restricted and repetitive behaviors, which has been one of the more consistent things that has been shown to be different between boys and girls, it depends, again, on the level of IQ. And so the difference between the girls and the boys looks different at higher levels of IQ than at lower levels of IQ. So if you were to take any one of these little slices and that were your study, you'd have very discrepant findings. If we look at social affect, so social difficulties, again, where there's the most distance is in these verbally fluent, higher IQ females who do show a difference from their male counterparts, at least in these clinical studies. But we have to think about who are the girls who are being referred in adolescence and who are these boys who are being referred in adolescence. And some of the similarity at the lower language levels may just be because those are the preschoolers who are coming to clinic. So this ascertainment issue is incredibly significant. So just like sex is not the only relevant variable, though, we also have to think about how ASD diagnostic status is not the only relevant variable, and that girls and boys are different, they're socialized differently from the very beginning. And the developmental literature has been really important in pointing out that girls and boys seek similar sex peers. That happens relatively early on. And then in fact, there's a cycle that happens where the more we seek out same-sex peers, the more socialized to act like that sex we are. So there are different arousal patterns, different preferred activities. All of these things affect your growing up as either a male or a female. And that varies across cultures too, and neighborhoods and where you live. And then if we throw onto that all the other things, and these are just a few examples of all the other things that differ between girls and boys, the point is that growing up as a girl with autism is different than growing up as a boy with autism, because growing up as a girl is different than growing up as a boy. And we don't want to ignore those contextual influences. They become very important, especially as people are older and are socializing in the world. And here we have autism is a social disability, and an important criterion is how people modify their behavior to adjust to different social contexts. And now we have a culturally defined social context, which is in part defined by your gender or your sex, and all of those things are going to affect the manifestation of symptoms. And in fact, here we see some of the recent literature coming out where when you make comparison between males and females with autism, you see differences. But when you compare males and females without autism, you also see differences. So then we have to think about who is the relevant comparison group here. And females with ASD are still females. So then a relevant comparison is not necessarily males with autism compared to females with autism, but in this case would be females with ASD compared to females without. So in terms of thinking forward, and this research is ongoing and we all have a lot of work to do, but we need to be mindful of the different reasons to explore sex differences, and there are a lot of important reasons to explore sex differences even when we don't find differences. So even if there aren't phenotypic differences or differences in behavior, biologically there are differences between males and females that may be very important for understanding etiological issues. And then in terms of identification, treatment response, and long-term outcome, again, if we find that females with autism earn less than males with autism, well, females earn less than males. And so we have to think about how that makes a difference for our conceptualizations of outcomes, and sex as one aspect of outcome. So sex is one important variable to consider, and in this work we have to carefully evaluate the appropriateness of the comparison group so that we make sure that we're thinking about people as individuals and not as big lumps of males or females. So thank you very much.